physical or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum and welcome to another exciting and educating edition of the Health and Fitness Show. I'm Fahad Matin, your host for today, and I pray, I hope and pray that all of us are fit and healthy by the grace of Almighty Allah. I do pray that we all had a nice positive week so far and looking forward for a nice, lovely Eid weekend. Yes, mate, it's Eid this weekend. And Inspire is doing a big Eid celebration. So if you do not know, then do come to our Eid celebration at Lucy Park. And definitely you will have all the rides and everything over there. So don't miss out and come and celebrate Eid with us. Yes, we are live from 12 p.m. going all the way to 8 p.m. And there are many rides just like always. This program is broadcasting live from the studios of Inspire FM today on 7th of July, 2022. And time just past 6 o'clock. And casting its positive vibes to all our lovely people in Luton and all the surrounding areas of Luton, like Dunstable, Harpeth, and Bedford. Our positive airways reaching all our listeners who are listening us through Inspire FM app or website. You can also view us via our Facebook link or YouTube link. All you have to do is just go to Inspire FM Facebook or YouTube page and click the live link. As we all know, we cover different health-related topics every single week. And today's topic is very unique in a way because we have never covered this topic before in last 8 years. Yes, indeed. It's almost 9 years since I have taken over and I have never done a topic which is this. So without further ado, today's topic, the topic which we are talking about today is rheumatology. Yes, we are talking about rheumatology, the diagnosis and therapy of rheumatic diseases. Yes, you have heard me correctly. We are talking about rheumatology. And as always, everybody knows that I'm not the expert in these topics. I always have lovely and very special expert guest. And like always, today I have a very, very special guest consultant. He's a very good friend of mine. And I'm really, really thankful to him because I asked him last night that if he can come and do this topic with me on this show, and he agreed kindly. So thank you so much. So my guest for tonight is none other than Dr. Balaji. Good evening, Dr. Balaji.
Good evening, Fahad. Good evening.
How are you, sir, today?
I'm keeping well, thank you.
And thank you so much for coming to our show, sir.
Thank you. Thank you very much for inviting me, Fahad. I've never been on a radio show before, I have to say. Initially, it was a bit unnerving. Hopefully, it's going to be okay
Inshallah.
As we've had many long chats, and it's going to be like one of those.
Inshallah, it will be absolutely fine. And next thing you know, I as most of my new guests always says, is the show finished? So it will be pretty much like that. So as our tradition goes of this show, I always ask our guests to introduce themselves and tell us about themselves and the expertise they're working in. Dr. Balaji is a rheumatology consultant in Luton Dunstable Hospital. But instead of me explaining about him, let me ask him to give a brief intro about himself.
Yes, thank you, Fahad. I've been at the Luton and Dunstable Hospital, where we both work, in fact, as a consultant in general medicine and rheumatology over the last 12 years or so. And I was appointed there after completing my high specialist training in the east of England, rotating through a number of hospitals. And my basic and undergraduate training is from the southern part of India. And I did some postgraduate training in internal medicine and also to some extent in rheumatology in Bombay before coming over to the UK. And so working here at Luton within rheumatology, I have some subspecialist interest in metabolic bone disease and also in some complex illnesses such as connective tissue disorders. And I do a whole lot of general rheumatology clinics, and I also contribute to acute and general medicine as a part of my role. And the other part of my role is educational, to kind of train, oversee, mentor junior doctors in my role as a Royal College tutor for general medicine at our hospital.
So you are shaping the new doctors' minds to serve as best as best as they can.
We try and do our best.
So thank you so much. Thank you so
Yes.
much for coming into
No,
our show, sir. So let me involve our listeners as well. So listeners, I know some of you may have some burning questions or some comments about our topic for tonight, which is rheumatology. If you have, then please give us a call on 01582 481822, or you can send your questions via text messages or WhatsApp on 0779 481822. I repeat, 0779 481822. And I'm Maj Abdullah. Yes, Eid Mubarak to you as well. So, further ado, let's jump into our show tonight, which is rheumatology. So, Dr. Balaji, please tell us about rheumatology, as in what is rheumatology?
Sure. Rheumatology, as is commonly understood, is an area of internal medicine where we investigate, approach, diagnose, and treat rheumatic conditions. Rheumatic conditions are those that affect our musculoskeletal system, muscles, the joints, and bones, and musculoskeletal health. Having said that, musculoskeletal illnesses are exceedingly common, and there are a wide range of conditions that afflict the musculoskeletal system. And it's not just the rheumatologists who look after these conditions. As we all know, we have orthopedic surgeons, we have physiotherapy colleagues, general practitioners, and so on. Rheumatologists, in particular, tend to look after a subsection of these musculoskeletal conditions, which tend to have an immunological basis or background, which is what kind of gives us a certain niche within the whole area of musculoskeletal disorders.
So, when we talk about these kind of things, disorders and diseases, so what diseases does rheumatology treat, or what rheumatologists treat?
Rheumatologists are generally able to approach, investigate, and manage all patterns and types of rheumatic conditions, which can range from common soft tissue conditions such as, a frozen shoulder or a tennis elbow, or an inflamed knee bursa, and what have you, and other conditions such as wear and tear, arthritis of wear, age-related wear and tear arthritis, going on to more serious conditions such as inflammatory arthritis, a huge spectrum of them, rheumatoid arthritis, which almost all of our listeners would have heard of, going up to rather rare conditions such as systemic vasculitis, lupus, and Behçet's, and so on, which have a very complex immunological background and tend to involve multiple organ systems and can have serious consequences if not quickly diagnosed and appropriately managed. So it's a wide, huge spectrum of conditions that we have to look after. Yeah.
Wow. So, in terms of, you just mentioned about rheumatic diseases in terms. So, what kind of symptoms we normally see in rheumatic diseases?
The most common symptoms that many of us would have with rheumatic conditions is pain, which can affect the joints or areas around the joint or muscles, which can be limited to a certain area, or it could involve multiple joint areas, or sometimes people may have more generalized pain due to certain conditions. So pain is arguably the most common rheumatic symptom that brings any patient to a doctor. And the other common symptoms that patients who come to see us have is swelling affecting joints, areas around the joint. And as a consequence of pain and swelling, there can be restriction of movement, limitation of functional abilities. And not infrequently, people may notice some color changes around the joints, um, uh, which would be another symptom as well. And significant proportion of patients with rheumatic conditions that may have an inflammatory basis tend to report stiffness, where the joints feel rather tight. The muscles around the joints feel rather tight when they wake up in the morning, and it takes a good length of time, 30 minutes, and however often longer, before that stiffness tends to get better, which is another important symptom that brings them to us. And apart from these more musculoskeletal specific symptoms, rheumatic conditions can have very generalized symptoms, such as feeling tired, not being able to eat well. Sometimes, due to the ongoing inflammatory process, patients may tend to lose weight. So these are amongst the multitude of symptoms that patients with rheumatic conditions tend to present.
Wow, wow. I just received a question from one of our listeners, Daud Matlub. He's saying, Assalamu alaikum. What foods can you consume to help when you have such problems?
Thank you for that question. It's a very good question, a very important question. I think a number of our patients do ask us such questions. I think a healthy diet is extremely important um, to maintain physical health. In the context of rheumatic conditions, we don't necessarily give any specific dietary advice in terms of what to eat and what not to eat, or food supplementation. We may certainly advise certain vitamin supplementation in certain specific situations, but what we advise is a balanced, nutritious, mixed diet, certainly with plenty of fiber, green vegetables, fruits, and in certain rheumatic conditions, certainly like gout, for example, we would advise patients to minimize intake of red meat, um, certainly minimize alcohol intake, which probably may not be applicable to most of our listeners, I'm sure. But then there are frequent inquiries about food additives. Turmeric is in vogue these days, and then there are others. Of course, most of us have turmeric in many things that we eat, which is good. But then there is no proven evidence of asking our patients to eat anything specific. So we don't make any specific recommendations on diet, but we rather emphasize on an overall balanced diet, which should help them maintain an ideal body weight, which, as I'm sure we all know, is very important as well.
Indeed, yes, and as Eid coming up in a couple of days' time, anyways, red meat is something which will be very common in our household, because it is the Eid of where we would normally eat more meat than anything else.
Of course, there are occasions when we all should indulge, but then I suppose make up for it.
Exactly, definitely. And as the doctor says, balanced diet is most important. So thank you so much for your question. If you have any questions or queries regarding our topic, or even your own observation about any rheumatic diseases like arthritis, rheumatoid arthritis, or osteoarthritis, or gouts, or anything else, please get in touch with us, either by calling us on 01582481822, or send your questions via text messages or WhatsApp on 07779481822. You can send messages on our Facebook page as well, and we will definitely answer your questions. So, Doc, when we talk about arthritis, so what's the basic difference between osteoarthritis or rheumatoid arthritis or gouts? So, what are the difference between these three? Because they are pretty much seems like same thing, because we say arthritis and then there's rheumatoid
Yes,
arthritis, there's
yes,
osteoarthritis, and there's gouts.
yes. I fully understand and I fully sympathize uh, with the views, common people have. And in fact, it's not easy.
Hmm.
And not infrequently people may have more than one variety of arthritis, which is unfortunate, of course. Broadly, you can, and as you rightly said, approach arthritis as two varieties, where there is the arthritis of wear, which invariably, most of us will have in one area of the body or the other: the neck, the lower spine, the knees, hips, certain parts of the fingers, the thumb base being more commonly affected. Um, this is due to wear of the cartilage, that is sort of a soft bone that cushions two bones that meet to form a joint. And as we age and then also subject to certain stress depending on our occupation or previous injuries, uh, and what have you, these joints wear. And that's what we call as the what we would call as osteoarthritis, or arthritis of wear and tear.
Hmm.
In sharp contrast, you have rheumatoid arthritis and a whole other varieties of arthritis, wherein it's not the wear of cartilage which is the trigger, or an aging process or an injury related wear of the joint, but it is a primary inflammatory process within the joint, which results in pain, swelling, and stiffness. Now, this is nothing that a patient has done, a person has done to get it. It's just the immune system. In a sense, I often explain this to my patients as the immune system is there for us to be protected from infections, bugs, and cough and cold and what have you. So we have this immune system which produces antibodies and sends all these cells, which destroys these bugs and then protects us. And then in some of us, weirdly enough, for unclear reasons, these very immune cells start targeting parts of our body. So rheumatoid arthritis is an example where the joints are predominantly affected.
Hmm.
So it's the immune system triggers an inflammatory response against the lining of the joint called the synovium. And that results in pain, swelling, and stiffness. And this inflammatory process can be so intense, if not checked promptly, it can result in damage to joints. So thus, your question was, you have an osteoarthritis, or the
Hmm.
most common variety of arthritis, which pretty much most of us will have to some extent in some area or the other, which is an arthritis of wear, as opposed to arthritis caused by inflammation, such as rheumatoid arthritis. Gout, of course, is a distinct variety of inflammatory arthritis, which is caused because of accumulation of a certain salt or a crystal in the joint called uric acid.
Hmm.
We can perhaps discuss that later, but essentially, gout is also an inflammatory arthritis.
Wow. Wow. That is amazing, because I never thought gout is an arthritis. I thought it's a completely different disease.
Uh, it is a distinct condition, but then it is one of the inflammatory arthritis, as we would call it.
Uh-huh. Okay. Okay. So, uh, uh, as you said, the other ones is different, but then rheumatoid arthritis, you said there's an inflammation of joints and itself. So, what cause rheumatoid arthritis?
I think that's $1 million question. I wish if someone had a conclusive explanation, uh, we'd move ahead. But then it's a combination of what most experts believe is to be nature and nurture. Is, I think, a proportion of us have certain genetic predisposition, familial predisposition, and research has shown that there are certain genes that are more prominently expressed in individuals with rheumatoid arthritis, predisposing them to that condition. Having
Hmm.
said that, not all of us who have such genetic markers, or even family members who have rheumatoid arthritis, necessarily go on to develop it. But then, those of us who have such predisposition or have a family member who suffers from rheumatoid arthritis are more likely to develop rheumatoid arthritis than those who do not.
Hmm.
So, thus, there is a familial or a genetic predisposition for us to develop rheumatoid arthritis. And the second component is some environmental exposure. It's not entirely clear as to what may be. There may be infections that have been blamed. Cigarette smoking, there's a fair amount of evidence that it may manifest with more aggressive varieties of arthritis,
Ah,
particularly in men. But then again, there is no single environmental predisposing factor which has conclusively been linked to be causing it.
exactly. Let me involve our listeners as well. So, listeners, if you have any questions or queries regarding our topic tonight, please give us send your questions or query via text messages or WhatsApp on 07779481822. I repeat, 07779481822. I just received a couple of text messages on my screen. One of the text messages says, "Assalamu alaikum warahmatullahi wabarakatuh. I suffer from gout, which hits me every so often. I found that pitted black cherries and apple cider does help. Apple vinegar, sorry, apple cider vinegar helps."
It's amazing. Very interesting. Very interesting. Thank you for sharing your experience. I have read about the health benefits of apple cider vinegar. A lot is written about it. I'm sure it must be doing some good. I'm not too sure about the cherries. Um, Gout is an extremely painful condition, and you seem to be suffering from frequent attacks. So, you probably may need to be on medications that ideally should be taken to reduce the uric acid salt, which causes gout. Because as painful as these attacks are, it's not just that. The uric acid salt can deposit in the kidneys and cause impairment of kidney functions. And over course of years, the recurrent attacks in the joints can cause some irreversible damage to joints. So recurrent attack of gouts would probably need to be treated with medications. Of course, dietary measures are helpful. There's absolutely nothing wrong taking apple cider vinegar and some cherries. I see no reasons why you shouldn't continue. But moderation of red meat intake, which we discussed earlier, would be extremely important. And of course, maintaining an ideal body weight, minimizing alcohol intake, which presumably is not applicable.
Indeed, and definitely get in touch with your GP as well to
Yes,
get
I
it
think so.
get it
That's what I would suggest, sir.
get it properly
I
diagnosed
would
and
certainly suggest
see
that.
what medications
There's no
can.
reason why you should be suffering with these attacks of gout.
Okay, cool. Thank you so much. Thank you so much, Taj, for your question. I have another question. Says, my arthritis flare up when the cool weather or damp weather is coming. It's from Dowd.
Thank you for that comment and question. I think this is another experience a lot of our patients do tend to have, and I have to say, especially patients from the South Asian region. We certainly used to warm weathers and warm temperature, and even whilst we're living in hot and humid cities, when the weather changes, some of us tend to feel a bit of tightness in our joints and muscles. Um, and I do see a number of Caucasian patients also mention that. Now, scientifically, it's difficult to explain that. It's possible that our activity reduces over winter, and then we tend to become more active over summer. And activity is, in a sense, related. Physical activity, I mean, is related to the tightness or stiffness of muscles and joints. Having said that, that alone may not fully explain this subjective symptom of feeling more poorly during winter.
Mm-hmm.
What I tend to recommend is for my patients who have such symptoms is to try and get into a hot shower
Mm-hmm.
first thing in the morning, or even a bath. And that tends to help most of them, and trying to just push themselves to do that and then get going.
So, when you said hot showers, but people do say that cold showers and cold water things are very good for reducing the inflammation. So, is that
Yes. Now that's a very very good point you make. Again, hot or cold, hot or cold. If somebody has an acutely inflamed joint, which is hot and even a faintly reddish, typical example would be gout that an early gentleman was asking us about. If there is a joint which is acutely hot, painful, tender, or reddish, certainly cold. Ice pack for gout. That's what is suggested. That's enormously helpful. But then the other gentleman, I assume, who asked us a question was about feeling queasy, not right in cold, damp weather, winters, just feeling very uncomfortable, achy, more stiff than the average, and, feeling miserable really in the morning when it's cold and damp. And I've just found, warming up, shower, bath, and then mobilizing, exercising. These are the things that help. Having a certain exercise regime in the morning, even if it's just walking, these things help.
Yeah, well, it did help me, to be honest, because when I wake up first thing in the morning, that's the worst thing I have. I have literally stiff joints, and then I have to literally crawl my way in a not figurative term, but yeah, I have to literally drag myself to the bathroom, and then I have to have a nice lovely hot shower in order to get my body back into the going mode, and so forth. And I must say, wow, the time has passed so quickly. We are just about to hit our first break, so when we come back from the break, we will talk more about rheumatoid arthritis, and definitely we will talk about other symptoms like osteoporosis and arthritis as well. And definitely we will talk about what are the best health conditions, and definitely vitamin supplements, what we can take and can't take. So stay tuned, and we will be right back after these very short messages.
This program will continue after the break. Continue listening to Inspire FM. Inspire FM.
Inspire 105.1 FM.
Assalamu alaikum. My name is Safana, co-founder of Project Ribcage. Find out about everything that we do on projectribcage.com, and feel free to follow us on YouTube. My message for today is for anyone looking to inspire change, and it is, if not you, then who? Please keep listening to Inspire FM on 105.1.
For expert legal advice and support, talk with Luton's leading solicitors, Hannah Solicitors. We specialise in conveyancing, wills and probate, family law, immigration and personal injury, legal matters that matter to you. Our experienced legal team are here to help you through every step of the way. Call 01582 329 069. That's 01582 329 069, or click on hannahsolicitors.co.uk. Hannah Solicitors, professional advice with a tailored approach.
Ideal Properties 20 साल से आपकी खिदमत में पेश आपकी प्रॉपर्टी की सारी जिम्मेदारी अब हमारी। हम अच्छी तरह से जांच पड़ताल करके किराएदार डालते हैं और आपको किराया बर वक्त गारंटी के साथ दिलवाते हैं। अगर आप प्रॉपर्टी किराए पर लेने या फरोख्त करने का सोच रहे हैं तो आज ही हमारे तजुर्बाकार माहिरीन से राब्ता कीजिए 01582721110 या फिर 01582696050। Ideal Properties, आपकी मदद हमारा एन फरीजा।
Whether you're looking to refresh your current bathroom or enjoy an exciting complete new design, you'll find everything you need at trade prices at Bath & Tile Superstore in Luton, with service with a smile from our super friendly staff. Why not take advantage of our 3D design service? Big names, designer brands at low prices. Bathrooms, tiles, radiators, adhesive, grouting and accessories. Visit the showroom where there's extensive stock to take away or arrange for delivery. That's Bath & Tile Superstore, Cosgrove Way, LU1 1XL. Don't forget to check us out on Facebook and Instagram for inspiration and updates.
Gurbani. It is the greatest sacrifice, a sacrifice that you feel, something of value that you part with, enough to draw you closer to Allah. It is the joy and hope of those in need, the essence of your faith, and your submission to Allah. This year, offer the greatest sacrifice with Muslim hands from £35 to £245. To order now, visit muslimhands.org.uk.
The best days of the year on Inspire FM. Being more dutiful to your parents than any other day will double the number of rewards you normally get and will help overweigh the sins.
Juggling too much? Trying to keep it all together without losing your mind? You deserve some me time. Join me, Neelam, on Mother's Planet every Friday at 10 o'clock on air at 105.1 FM or via our Inspire FM Facebook page. I'll be sharing tips and discussions with my guests on topics from kids, what to cook, health, well-being, and lots more for all you special mums. That's Mother's Planet every Friday from 10 a.m. only at Inspire FM 105.1 FM.
From the studios of Inspire FM, the time is now 6:30.
Any health advice given, whether general, diet, physical, or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum and good evening to all our listeners and viewers. Welcome back to the Health and Fitness Show. I'm Fahad Matin, your host for today's evening, and today we are talking about rheumatology with our guest, Dr. Balaji from Luton Dunstable Hospital, from Bedfordshire Hospital, the Luton Dunstable Site. This program is broadcasting live today on 7th of July 2022 and the time just past 6:30. From the studios of Inspire FM, for our lovely people in Luton and all the surrounding areas of Luton like Dunstable, Harpeth and Bedford. Our air is reaching to all our listeners and viewers who are listening through Inspire FM radio app, website, or viewing us through our Facebook and YouTube channels. Good evening and welcome back. So as I said earlier, we are talking about rheumatology, and definitely if you have any questions or queries regarding our topic tonight or about rheumatic diseases like arthritis, osteoarthritis, rheumatoid arthritis, gouts, osteoporosis, and anything else, get in touch with us by sending us a text message or WhatsApp on 07779 481822. I repeat, 07779 481822. You can send your questions or your observations or even your experience. Share your experience with us. Definitely we'll love to hear from you, so get in touch with us, and definitely Dr. Balaji, who's with us in the studio, will definitely try to answer as best as he can. So before we went on break, we were talking about the rheumatoid arthritis, and we asked what causes rheumatoid arthritis. Now Dr. Balaji, firstly, welcome back, sir.
Thank you, Fahad. Hello, everyone.
Definitely. Normally, I always start with welcome back and thank you so much for being with us on the first half of the show. And I presume by now you are relaxed. It's not daunting, and it's your veterinary show. It's your very first show.
It's been a very enjoyable experience. Yes, thank you.
So in this part of the show, we normally carry on with rheumatic diseases, definitely, but we'd like to know a bit more about rheumatoid arthritis. Now, you discussed about the different symptoms, signs, and definitely causes. However, what are the 5 signs of rheumatoid arthritis which anyone should look out for? Because if I'm not mistaken, rheumatoid arthritis is creeping very closely, very slowly, and it does not appear up unless you go through certain diagnosis, isn't it?
Yes, that is very true. And in some rare situations, indeed, it may come on extremely quickly, but most often it just creeps in gradually, as you rightly mentioned, over course of days to weeks and sometimes months, and then people sometimes do tend to get used to some of these symptoms, and it takes a while before unfortunately, before it's diagnosed. And we've been rallying around with general practitioners and also through other forums, although not myself in radio channels, which is certainly, I think, a good way to try and inform people as to what these symptoms are. There is a delay in diagnosis. Now, as you asked me to name 5 signs, I can probably just go through the important symptoms that one needs to look out for. Pain, as we discussed earlier, is one of the main symptoms. In the case of rheumatoid arthritis, most typically, what tends to happen is the finger joints and the wrists are predominantly involved, and it's pain in those areas, but not necessarily just in those areas, tends to more typically affect people with rheumatoid arthritis. Swelling is almost always associated with the pain of rheumatoid arthritis, particularly in the knuckles and the back of the hands, and quite frequently around the wrists, but also very frequently in the elbows, shoulders, knees, and across the toes. People may complain of finding it extremely difficult to walk because pain on their forefoot below the balls of their toes, which is because of inflammation of those joints. And as we discussed earlier, stiffness is an extremely important feature of rheumatoid, or for that matter similar inflammatory arthritis, which lasts for at least 30 minutes, but very often more than an hour or longer. Patients find it extremely difficult to get going in the morning, and as the day goes by, they feel the symptoms have improved. This is in sharp contrast to osteoarthritis we were discussing earlier, where the pain tends to get worse when they get into certain types of physical activities, such as climbing steps or climbing down steps or bending, lifting, depending on the area that's affected. But in rheumatoid arthritis, most often the pain and the stiffness tends to get better as the day goes by. And other important symptoms would be, difficulty in doing certain tasks. Dexterity tends to be affected when people have stiffness, pain, and swelling in their fingers. Doing simple day-to-day tasks can become really difficult, such as opening a can or turning a key and what have you. And it's really important to be mindful of these symptoms. And if any of us do notice these symptoms, particularly pain and swelling of 2 or more joints with prolonged stiffness, we should certainly consider seeking some medical advice from a general practitioner's perhaps.
So in terms of treatments, because you just mentioned pretty much half of our population of Luton, where majority of the people normally go through these kind of pains and stiffness. I can not personally experience that, but I have seen my younger brother struggle with that, and then he is on certain medication, and he has a really long journey to reach to a certain sets of injections, which he normally takes every 2 weeks. And definitely it's a really long and painful journey for him, because I can see that he struggled quite a lot, and sometimes he does struggle when the weather changes or when he's not well. So in terms of the treatment, so what sort of treatments are available for rheumatoid arthritis?
I think there's excellent treatment options available for rheumatoid arthritis. It's not just the treatment options; it's the treatment approach, which is considerably changed in over a period of time, perhaps longer than a decade, in fact now, and it's very sharp. What we try and advise is for patients who notice any of these symptoms to seek attention with their GPs, and once the GPs suspect that this could be a rheumatoid arthritis, they're advised to refer on to us, and we see the patients within about 2 weeks. So it's almost like, cancer waiting time, you can in fact say, we would like to see our patients with rheumatoid arthritis that early. The reason why I'm going through this is because there is a certain window, we believe, and there is a fair amount of evidence for that as well, that window in which if we intervene and try and suppress this immune system that's causing inflammation, we can perhaps even switch off the inflammation and protect the joints.
Wow.
So if unchecked and inflammation continues for prolonged months, joint damage occurs, the cartilage gets damaged. And unfortunately, if the cartilage gets damaged, that can't be undone. Although, of course, the inflammation can be controlled, the pain, swelling, and stiffness can be controlled, and patients tend to get better. We can't undo the damage. So, in terms of the specifics of what treatment is available, broadly we have what we call as disease modifying treatment for rheumatoid arthritis. We have the conventional disease modifying drugs and the newer or the biological disease modifying drugs. So by and large, when we see patients, we would tend to start them on a combination of conventional disease modifying drugs, which are tablets, which work on the immune system, either modulates it or suppresses it to ensure the inflammation is controlled. Of course, we would treat pain with painkillers, anti-inflammatory tablets. We would use steroids, which control the immune system in short term. But in the intermediate and long run, it is the disease-modifying drugs that we tend to use for rheumatoid arthritis.
So, when you said disease-modifying drugs, so when you are on those drugs, will the disease become null and void, or will it become zero?
That's a very good question you ask. I think it's very important to understand the nuances of these things. Yeah, as much as we would like, yes, we would. There is a certain way how we assess inflammation and disease activity. It's a semi-objective system of where we look into various parameters, taking into account swollen joints, tender joints, patients' subjective perception of their arthritis, tests of inflammation, and what have you. If we were to look at it from an idealistic perspective, perhaps is what you said. If you say if inflammation is null and void, is where someone would say, I have no pain, I have no swelling, I have no stiffness, I have no general symptoms such as tiredness, etc. The x-rays have not progressed or look normal, the blood tests don't show inflammation. That would be the kind of utopian goal for managing rheumatoid arthritis. It is possible in some situations, but not necessarily so in all patients. It is again more possible to achieve objectives close to that when we see patients very early in the course of that disease.
Thank you so much. So, in terms of if one what should one do if one's arthritis is flaring up, just like one of our listeners who have asked that they have flare-ups
Sure.
in the winter or cold weather. So what should one do?
Sadly, flare of arthritis is not something that does happen in rheumatoid and similar varieties of arthritis. I think identifying signs and symptoms of flare would be important, which is increasing stiffness, increasing pain, and flares can affect a number of joints, or it can affect one or two joints, and depending on that, we may tend to manage it differently. But what people can do themselves is to kind of relatively rest that area, not necessarily take complete rest, but relative rest of that area. Apply if the joints are certainly hot and warm to touch, as we discussed earlier, cold packs would help. They can take simple painkillers, anti-inflammatory tablets, unless it's contraindicated for any reason in a given individual. These are things that patients can do for themselves, and in case they have a supply of steroids, etc., and they've been advised to take it, they can do so. But then generally, what we advise is if this flares are particularly troublesome, they're not getting better, they should contact the rheumatology advice line, who would deal with it as appropriate.
So anybody can call that line, or is it anybody who's
generally, yes, patients who are registered within a rheumatology firm will have access to numbers and email details and what have you, and they are advised to contact, and the nursing team, the admin team will highlight that to doctors, and we would then treat the flare with certain medications, or sometimes if it's just affecting a particular joint, we may inject it with steroids that mitigates the inflammation, and the patients tend to feel better.
Okay, thank you so much. One of the things which is very different is fibromyalgia. Does a rheumatoid arthritis treat fibromyalgia? Am I pronouncing it right?
Fibromyalgia, you're pronouncing it right. You were asking me if a rheumatologist treats fibromyalgia. Fibromyalgia, here we have to understand, is a different condition. It's not an inflammatory rheumatic condition. It is a chronic pain condition, and in fact, a significant minority of people may well have or develop fibromyalgia at some stage. Studies would say about 5 to 15 out of 100 people in the community may have symptoms attributable to fibromyalgia. It's yes, rheumatologists do approach, investigate, and offer advice and treatment for fibromyalgia. It is a diagnosis of exclusion because it presents with widespread aches and pains affecting joints, muscles, soft tissues, along with a number of other symptoms. It can mimic rheumatic conditions, and it would be important to make sure that these individuals are carefully examined and concerning conditions are excluded, and they're offered appropriate treatment. They are not treated with disease-modifying drugs or steroids or the kind of, if I might use the term, heavy-duty medications that we would use, but we would use simple painkillers and certain other medications. But then the approach to treating fibromyalgia is different because of the different nature of its presentation and clinical course. We often involve colleagues who are in the allied therapy region and exercises, relaxation techniques. We get a clinical psychologist involved in a selected number of these patients and offer them pain management programs. So the fibromyalgia is a different condition.
Right. Okay. So in terms of to help relieve the symptoms of rheumatoid arthritis, is there any medications? Is there any medication that one only way to help relieve symptoms of rheumatoid arthritis?
Thank you. That's a very good question. I think you're asking me, are medications the only way to improve symptoms of rheumatic condition? I think the simple answer is no. In fact, maintaining an ideal body weight, exercising regularly, and going back to what another gentleman asked us earlier about diet, having a balanced, healthy diet with all the appropriate nutrients, these are all extremely important, and it'll go a long way to help us not just maintain a good general health, but also alleviate rheumatic symptoms from a number of these conditions. Exercise in particular is important. It promotes muscle strength. It maintains flexibility, apart from, of course, helping with cardiovascular health. What happens in a whole lot of arthritic conditions is that when the joints are inflamed or they become worn as an osteoarthritis, the muscles above and below the joints tend to get weaker, they get thinner. And that compromises stability. In the case of large joints like the knees and hips, the mobility is affected. People become vulnerable to suffering falls and what have you. So strengthening those muscles is extremely important. It protects the joints and it minimizes symptoms, and it enhances the overall functional status of the individuals. So certainly there's a lot that can be done outside medications.
And when we are talking about medications, one of the things which is very common is the vaccination, especially now day and age we are in COVID situation where we have to take the medications. So can a person who's been diagnosed with rheumatoid arthritis can have medications like vaccinations, like COVID vaccines or flu vaccines or something like that?
Thank you. That's a very good question. When you say medications for rheumatic conditions, there are these important medications that we use for conditions such as rheumatoid arthritis, which are immunosuppressive in nature. What they would do is to suppress the immune system to kind of amplify the inflammation and protect the joints and what have you. So in individuals who are on these potent medications, we would advise them to have live vaccines.
Mhm.
Now, there are not very many live vaccines, and many of the vaccines that are used are inactivated and killed.
Mhm.
The COVID vaccine is one such example, so we've advised all our patients to have it.
Mhm.
And the seasonal flu vaccines, the pneumovax, etc., they're not live vaccines. But then if people are traveling abroad and they need to get something like an yellow fever vaccine if they have to go to Africa, etc., and they're on one of these medications, then it's really important that they have a conversation with the GPs or us to move further. But by and large, unless it's a live vaccine, it should be okay to have a vaccine.
Okay. Well, I do want to ask you about osteoporosis as well. So, osteoporosis is one of the rheumatic conditions, correct?
It's a metabolic bone condition. So it does come under the umbrella of a rheumatologist's practice.
Mm-hmm.
So osteoporosis is a very common bone health disease.
Because whenever we talk about osteoporosis, one of the things which majority of the people think that it is just affect females rather than males. Is that correct?
It is incorrect. Osteoporosis does affect men as well. Having said that, it tends to affect women more often than men, particularly after menopause, which is because the hormones that are produced until menopause are significantly reduced, which apart from the reproductive function are also necessary for maintaining bone health in women, which is why osteoporosis is more common in women. Men also do get osteoporosis, and we see very many men as well suffering with this condition.
Wow. Okay. One of the things which people do think about is vitamin D. Now, being people from the subcontinent background, that's one of the things about human body. We have a very big lack of vitamin D, iron, and all sorts of things. So, can one get all the vitamin D from sunlight, or do we need to take some supplements as well?
That's a very interesting question, Fahad. I think, vitamin D, I did a talk some years ago, and I titled the talk is Sunshine Vitamin. I don't think.
Why do you think I'm asking you this question?
Yeah, I don't think it can be better. It's not something that we have in good supply, and
in UK
today's not been bad. The answer to your question is yes, we can get more than enough vitamin D by just sun exposure. And all that we need, and people really need to know this, is about 20 minutes or so of sun exposure on a sunny day should be enough to make about 1,000 units of vitamin D, which is more than what we need as a daily requirement. And again, it's only the usually sun exposed parts of the body that need to be exposed, like the face and the forearms and what have you. So it's not that we have to wear less clothes or anything. The normally sun exposed parts of the body, if they're exposed, that itself is enough to get us the sufficient amount of vitamin D.
Wow. The reason I'm saying wow, because we just have literally 4 minutes to end the show, and the time has passed really, really quickly. It doesn't feel like the whole show is about to finish.
I know.
Exactly. So as our tradition says, we just have 4 minutes to the show to finish the show. Can you give us a quick catch up or update of that topic and a positive message, and if possible in Urdu or Hindi?
मैं कोशिश करता हूँ. अब मैं साउथ इंडियन हूँ, आपको पता है, और मेरा जो language skills है वो limited है.
If you're not comfortable, you can always say it in English as well. So no problem.
I'm sorry. So just to continue on that vitamin D thing, which I think is exceedingly important for people who are listening and all of us. People of South Asian origin, or for that matter, any colored people, do not make enough vitamin D, even on modest sun exposure. So the winter months and late autumn and early spring, etc., the quality of sunshine in the northern hemisphere is not good enough to make vitamin D. So it's very important for South Asian people to consider vitamin D supplementation.
And also those amongst us who wear body concealing clothes may not get enough sunshine. So I think, again, that we need to be mindful of, and they would also need to consider vitamin D supplementation, if I would say, as an important message to people listening. And sitting in a conservatory, people ask me, will that be good enough to make vitamin D? Answer is no. You have to get direct sun exposure to get vitamin D. Okay, so that about it. But otherwise, in general, overall, on the areas that we've discussed, rheumatic conditions is exceedingly common. It forms about 30 to 40% of all primary care consultations. Most of the rheumatic disorders tend to afflict our soft tissues and tend to be due to wear and tear arthritis, which cause considerable discomfort and pain, but is not perhaps as serious as the more immunologically mediated conditions such as rheumatoid arthritis or other less common immunological conditions who come to see us. So people need to be aware of those cardinal symptoms that we discussed as persistent pain, stiffness lasting for 30 minutes, an hour or longer, often associated with feeling generally unwell, tired, which is disproportionate to what they felt previously, are sort of symptoms that should alert them and get them to seek medical advice. So those are some of the key things I would say. And also, I think it's important for people to be aware that there's excellent treatment available for various rheumatic conditions, and they should, access these. And lastly, if I might say, maintaining an ideal body weight, eating healthily and exercising regularly will go a long way to protect not just our musculoskeletal system, but also general health.
Thank you so much, Dr. Balaji, for being us and giving us the advice. And that's all for our show, guys. Thank you so much. Assalamu alaikum.
Thank you.
Assalamu alaikum. In Luton and its surrounding areas, it is now time for Salat al-Asr.
लुटन और इसके मज़ाफ़ात